Hi everyone, my name is Lily Ballman. I'm a sophomore dental hygiene student here at the University of New Haven, and I just wanted to inform you about why I think you should floss more, why it's important to your oral health and your overall health. First, I'd like to start off by saying that your gums are not bleeding at the dentist because we are like jabbing them or stabbing them. Your gums are bleeding because you do not take well enough care of them by flossing regularly and having the proper oral hygiene care routine. So, firstly, I'd like to talk about why you should floss. I think flossing is so important to prevent gum disease. Gum disease or gingivitis is when your gums are swollen, red, inflamed. There's a lot of bleeding. That could be why you have bleeding when you're flossing if you don't floss a lot. Gingivitis is reversible, but if the gingivitis is not taken care of, then that can lead to periodontitis, which periodontitis is non-reversible. It's actually bone loss in the roots of your teeth, which can, the further longer you have it, can cause your teeth to be not as mobile as they're supposed to be. You can possibly lose teeth. It gets very, very severe. Um, Yeah, but you do not want gingivitis. Gingivitis is also not, they're both not very painful, but they're just very, not pleasant looking, not pleasant smelling, all of that. So, I think it's important to, of course, maintain good hygiene. Um, Having gingivitis makes your breath smell. Having periodontitis makes your breath smell even worse. It's actually like a known thing in the dental field when somebody has perio breath. It is a very, very strong smell that nobody wants to smell, nobody wants to be around. Also, flossing helps to remove the plaque between your teeth by, I don't want to say, trying to say in more simple terms, like messing with the layer of bacteria that's sitting on your teeth when you brush and floss. You get rid of that every day so it doesn't stay on your teeth and build plaque. Which, if you know, obviously, I'm hoping almost all of you have been to the dentist. That's the yellow buildup, thick, calculus-like stuff that is can get between your teeth if you're not taking well enough care of them. And obviously, no one wants to kiss or be near someone whose breath smells. So, yes. Then, of course, this is the most important that something a lot of people do not think about, which is that flossing supports your overall health. Um, I don't think you've ever heard this one, but the mouth is the gateway to your body. Your oral hygiene is so important to your overall health. Um, Flossing can help to reduce heart disease, or the risk of heart disease. It's just having a healthy mouth, gums is very, very um, positive, effective to your health. And for pregnant women, um, it can potentially lower the risk of pregnancy complications by having healthy gums. And then, of course, having a nice, healthy smile can improve your mental health, boosting your self-esteem by having a great smile, making you feel more confident in yourself, who you are. You don't want to be afraid to smile, be unconfident about it. And so, to leave with that, I challenge you to improve your um, oral hygiene routine, whether that's you don't floss right now at all and you want to start, totally start with that. Nothing wrong in that, nothing to be embarrassed about. Or if you think you don't brush as much, you should be brushing twice a day with a soft toothbrush, soft bristles. So if you're not doing that, maybe only once a day, maybe you're just doing it in the morning, try to do it twice. Of course, if you're not flossing at all, like I said, start to floss. If you think that you're not flossing well enough, definitely try to get better at that, which the best way to floss would be, oh, I don't have any with me, but take a string, wrap it around your two middle fingers and hold with your um, what is this, your thumb and your index finger. You're gonna put more on one side than the other, and you're gonna slowly slide it in between your teeth. You don't want to snap it. Slowly slide, bend it to one way and up, slide back down, and bend it to the other way, up, slide back down, and then slide out. And then you want to move. Say this side has less and you have more on this side. Whichever part you just use on the one tooth, you want to pass over to your next finger, get a clean piece for the next spot. And fun fact, you are supposed to floss behind your last molars. Even though there's nothing in between, plaque can still build up, and that is very important. So, hopefully, I just saved you a deep clean that you needed the dentist. And yeah, Thank you for listening, and I look forward to watching everybody else's, and thank you.